about?
I'm Frank Scott with NetHope. We had infrastructure, data, and I actually had probably the smartest group of people back there. And so if you don't like anything, it's my poor articulation of the brains that are in the back of the room there. You'll notice that we didn't actually do all of our homework. We thought we were only supposed to fill out certain squares, but certain spots. But key players we had as responder organizations, implementers, donors, supporters, vendors, kind of all lumped together, and then beneficiaries and healthcare workers. The issues to solve in comms and data, one was basic, and I'll talk a little bit about funding in parallel, because we had kind of a conversation about who funds what. So basic communications capabilities. The dream scenario would be that you would have durable existing infrastructure that could withstand whatever emergencies present themselves. And I think we know what the 30 most disaster-prone countries are. And so I think building infrastructure in those places could pay off for us, and there's a variety of different ways to perhaps fund that through the private sector in those countries, governments in those countries, World Bank, USAID, Universal Service Funds, but that's probably not the role of kind of the U.S. private sector to go help build. But where there isn't existing infrastructure, we need to have solutions that are ready to go, and that means stockpiling equipment in certain parts of the world so that we can ship things in quickly and get communications capabilities ready to go. And we're part of the converted, so communications are the lifeline of every major intervention in emergency response, whether it's health, water, sanitation, logistics, coordination. You have to have comms capabilities, and so having a stockpile of comms ready to go anywhere is essential. On the data side, we broke that down into 3 areas. One is an open platform and protocols for sharing information. There was a fair amount of discussion around standards and the types of data that get gathered and get shared. And then there was some discussion around metrics and analytics. And here's a place where I think we could benefit, the NGOs, especially in the governments, could benefit from the private sector, who especially the likes of some of the big consultancy firms and those that are working on big data and data visualization could really bring some expertise that you would never find at an NGO, and even in some of these governments you'd never find. We talked about apps, so sharing of apps and training staff on the use of apps, and then sustainability, so sustainability or how it's funded today as well as how it's funded long term. The value proposition is better service delivery, which translates in 2 ways. One is better decision support, so we're making decisions based on data, and I think of all the emergencies we've been involved in, the data has been the lousiest in this emergency for a host of reasons. But having good data allows you to make good decisions and proper resource allocations. And so that's all part of the better service delivery proposition. And then to Dr. Farmer's comments, learning for the future and building infrastructures and strengthening existing systems is also part of the value proposition. So we're going to learn a lot from this emergency, just as we learned a lot from Philippines, just as we learned a lot from Haiti. And I think there's some quote, I'll get it totally wrong, but shame on us if we make the same mistake more than once or twice, right? We ought to be learning and getting better all the time. So that's the sum of the work of that amazing group back there.